Welcome to video 12 for chapter 5, the integumentary system. So we're going to continue our lecture on accessory structures in the skin and with glands. So the first type of gland, and these glands are located mainly in the reticular layer of the dermis. Just to talk about that again. And the first gland we're going to talk about, or the category, is called a sebaceous gland. Sometimes these are referred to as oil glands of the skin. This is a holocrine gland, going back to our terminology from chapter 4. And they are connected by a duct to the superficial part of the hair shaft. So this kind of actually attaches right above the follicle onto the hair shaft, and the oil comes out of where there would be an opening for a hair. And they produce something called sebum, S-E-B-U-M. And this is an oily white lipid. And it has some purposes. It helps for lubrication of the hair because oils are good for the hair. Waterproofing, because it's a lipid, it's going to repel water. And it helps hinder bacterial growth. And these are the ones, when we talk about acne later, that are going to be very active during puberty and cause a lot of pimples. So if you get a zit, it's usually because this oily white lipid plugs up a pore on the surface of your body and traps some bacteria in there. So when you get a whitehead, it's actually the sebum and a little bit of pus that forms that, and as that is exposed to oxygen, turns black because it oxidizes. So these sebaceous glands can also become infected and cause an abscess, and we'll look at that in a video or two. They are rather gross. If you watch Dr. Pimple Popper, she does a lot of sebaceous cyst removal. So if this gland gets infected, it can form a big pocket of pus, and you have to either drain it, and it smells god-awful. If you've ever smelled an abscess, you will know what I'm talking about. The next type or category of glands are sudiferous glands or sweat glands. And we have several different types of glands that are sudoriferous. We have eccrine and apocrine sweat glands. Eccrine are a American gland, and they produce watery sweat on almost all skin surfaces. Most numerous on the palms and soles. So people get very sweaty hands and sweaty feet because we have a lot more of these eccrine sweat glands. They're ducts and at pores on the skin, and they are typically activated by a heat response of your body. So there is a feedback cycle that if your temperature increases, we end up sweating because the sweat, as it evaporates, is going to actually take heat off of your body and cool you down. And the other thing that can activate these are stress. So if somebody is really stressed out, nervous, and they end up with really sweaty hands and sweaty palms, that's because that is a reaction of our stress system. The other type of sweat gland that we are familiar with is the apocrine. These are found in the axillary and genital regions. So these become active at puberty. And they open at follicles. So as you develop hair in your armpits and your pubic region, these are going to open at the follicles, and they secrete a very oily, thick, organic substance, much like sebum, and they are typically eaten by bacteria that release noxious gases, which we call BO, body odor. So it's not really this substance that smells, it's bacteria that live in your armpits and your crotch that eat this thick organic substance that's secreted and release gases as their waste product that smell bad to us. But one of the other things that's in this secretion is going to be pheromones, and those pheromones help attract a mate. So there is a little bit of odor that is released that helps get you noticed. We tend to nowadays try to cover up these smells. Some people don't release a lot of smells. Some people can clear a room. So this kind of sweat is different than the sweat that you might have from being active or being stressed out. Ceruminous glands are found in your ear canal. So they are modified sweat glands that produce cerumen, which is earwax. So that is a type of sweat gland, and here we have a substance that's produced to help trap dirt and anything else that might get into your ear canal to prevent it from going in. And you can have a blockage, and you can go to the doctor, and they basically take a syringe, take the needle off, put warm water in it, and shoot it in there, and it helps break it up. And then we have the mammary glands, which are classified as a modified sweat gland again, and we know that these are involved with lactation. So they're involved in producing milk. So those are the different glands that are present in the skin.